Mobility patterns in Uganda changed abruptly due to enforcement of COVID-19 restrictions to contain the pandemic. Millions of Ugandans were left with limited means of motorized transport. A study by Makerere University School of Public Health shows that restrictions on COVID-19 prevention affected the mobility of essential workers. Ministry of Health failed to accommodate and facilitate health workers, hence losing more lives due to limited transport.
Reminds us of the need to implement the government-owned transport. Can we have the buses? And the long thing, also the other benefit from that, you're going to have less traffic on the road, less pollution. This pollution causes what they call non-communicable diseases, the cancers, the cardiovascular diseases, all these.
However, Ministry of Health spokesperson Emanuela Inebiona says the ministry tried in its capability to enable workers reach different destinations.
And that's why there was an option of having a patient access for instance, border, provided you had clearance. In our communication, there were exemptions. But I want to note that the earlier first 2 weeks were very challenging for both the patients and also the caregivers. The Ministry of Works and Transport came up with the permits. And these permits were at least acquired through an e-platform. And this was also unlike the first lockdown, where people had to physically come for stickers.
Meanwhile, the lockdown challenged city leadership on how the structure of the central business center looks like.
To change our structural designs of the roads so that they incorporate lanes for different road users. We have cyclists, we have pedestrians, we have cyclists, we have pedestrians. So we must have cycle lanes, we must have bus lanes, we must have walkways for pedestrians. That's how now we want to have our roads designed.
Researchers say it's the role of government to provide essential services and discourage use of private vehicles in high-density urban areas. Shaidat in Nasaku, UBC News.